everyone, and for the invitation and encouraging me to speak out to more groups. This is not something that I do a lot of, so hope you bear with me, but I feel like it's important to communicate to as many people as possible that businesses are not, the media story is that businesses don't want more taxes, don't want more government programs, and that really couldn't be further from the truth in my experience. So I am the owner of SmartSet Incorporated. We've been around for 33 years in Northeast Minneapolis. I was the first full-time employee, took over the company in '92, so I've been at it for a little while. We do graphic design, digital printing, pre-press work. We have a current crew of 5 people, including myself and my wife, who works part-time as our bookkeeper. About 40% of our work is with nonprofits. We work with a lot of artists and creative types in Northeast, so we do business cards, brochures, books, that sort of thing. About 3 years ago, we became a certified B Corporation. So Certified B Corps is an international movement that really is trying to bring the values of the nonprofit world into the for-profit arena. So we are evaluated every couple years in 3 different areas. The first being how we treat our employees and our financial transparency. The second being our environmental footprint and what we're doing to reduce our impact on the environment. And the third being our engagement in our community. So how are we involved in our community? What percentage do we buy from local suppliers and support the local community? It hasn't really caught on in the Midwest like it has on both coasts, but it's growing. I think we were the 7th certified B Corp in Minnesota. They're now close to 20. This spring, we also became a union shop. We are now members of Communication Workers of America Local 7002, which is under the AFL-CIO. That was actually initiated by myself, and to be totally transparent, there are some advantages to being a union printer in that I can do printing for DFL candidates and other unions and progressive groups, so that was important to me. But also, I think it was very important to me that I put our values out there front and center, and part of doing that is to really promote how much we respect our employees and how we treat them and how we pay a living wage and provide benefits for them. So clearly one of the benefits that we all need is healthcare. We've been paying healthcare for our employees for all 33 years of SmartSet's existence, and I have to say for close to 20 years of that, it wasn't really a big issue. I got the bill, I paid it, I didn't think too much about it. Then premiums started to go up. We started to really see that as an impact on our bottom line and started looking at what we could do to reduce that cost while still providing that benefit to our staff. Premiums were going up 10, 15, 20% a year. And we were sort of excited when ACA happened. The first year of ACA, our premiums went down by 50%. The second year, most of that went away. We thought we were being creative by saying, well, maybe everybody doesn't need the same plan. Let's pay a healthcare benefit to all our employees in a cash amount to allow them to go on the exchanges and buy the plan that they thought suited them the best. That worked for 1 year. Staff came back and said, oh, we got our renewal notices, policies are going up 30%, we're all gonna drop our plans because we can't afford it. So then we went back to a small group plan. So we've been on that since then. You know, probably every 2 or 3 years, we switch companies just to try to knock that rate down a little bit. But it's tough. Currently, we are paying over $3 per employee hour worked for healthcare. Additionally, the employees end up paying another $1.70 an hour to cover their deductible. So you hear in the news about, you know, wages stagnating. Well, that's true, because how can I pay higher wages when my benefits costs go up 10, 15, 20% every single year? It's pretty obvious. Me personally, for our family of 3, we pay over $25,000 for our healthcare insurance. And after taxes and insurance, my take home is less than $40,000. So that's money that I can't put into my business to buy new equipment, to hire more staff, to do marketing, to support other local suppliers. We spend over 20 hours every year just on, you know, when renewal time comes, to look at the plans, look at what the options are, interview the staff, what kind of networks are they in, what providers do they have. We don't want anybody to lose providers by switching plans. But we're not experts on healthcare. We don't. You ask me anything about printing, I can give you a solid, reliable answer. I know nothing about healthcare. And yet, as small businesses, we're expected to be the solution to providing healthcare for everybody in the country. It doesn't seem very logical. Deductibles are getting so high that people are now avoiding going to the doctor to try to avoid taking that hit and paying out of pocket. If you're 25 years old and you got to pay $3,500 of your first off the top medical bills, are you going to go to the doctor when something's bothering you, but you can still get up and go to work? Probably not. So people delay care. People put off, you know, we see myself even at this time of year, if I can avoid going until January, I'll hold off to try to pile up my expenses onto the next year. It's not a very effective way to get healthcare treatment. So part of what I took on in dealing with this issue was to start talking to other small business owners. And a fellow business in my building that we were doing some printing work for was telling me about Main Street Alliance a couple years ago. So I went to one of the networking meetings at one of the member breweries. We have a lot of members who own breweries and restaurants, so that's a great thing. And I was immediately impressed by how, even though we all ran completely different businesses, from printing to landscape architecture to you know, running a brewery to a professional services company, we all shared the same experience in dealing with this issue. So Main Street Alliance has been around for about 3 to 4 years in Minnesota. It's a national organization with state chapters. I think there's currently 15 state chapters. We have one of the most active. I would say we have currently around a couple hundred members, both in the metro area and in greater Minnesota. And our focus last year and this year has really been to reach out to small business communities around the state, get more members in smaller communities. We have a great group in Duluth, in Bemidji, there's some members in St. Cloud, and also trying to focus on the suburban area around the core of the metro area. Main Street Alliance's focus is really on lobbying at the state capitol for progressive changes that will help small businesses and our employees. You know, I think if you talk to any small business owner, they will tell you the most important asset they have is their employees. You know, you can't work with somebody every day, 8 hours, 10 hours a day for years and years and not care about them, right? So I think small business owners have an inherent sense of concern and care for the well-being of their staff. I also, about a year and a half ago, joined Metro IBA. So Metro IBA has been around longer than Main Street Alliance, but is also sort of focused on business owners in the Twin Cities metro area. While Main Street Alliance is primarily focused on lobbying and political change, Metro IBA has sort of a broader focus in providing networking opportunities, resources on professional services, training, education, that sort of thing for its members. I joined the policy committee. I've been on the policy committee for a little over a year now. And we decided last year, and that's continued into the coming year, that healthcare is our main focus and the only issue that we're gonna work on as a policy committee. Both Main Street Alliance and Metro IBA have issued written statements supporting single-payer healthcare. Metro IBA specifically referencing the Marty plan. So you can go to our website and that's in writing that we support any number of intermediary steps, but that's the ultimate goal. We need universal health care and we need to take this burden off the backs of business owners. I've got a fact sheet. So as a graphic designer, when I get involved with this issue, I realized, you know, people don't really know what the impact of small businesses are in our state. You know, there's this tendency to think that everybody works for a company like 3M or Target. It's not really the case. So I spent a fair amount of time going through government statistics and trying to present this in a visual form. And this has been very helpful in going to the state capitol, and we make sure every legislator that we meet with gets one of these. In fact, at a meeting with Governor Walz, he actually, when he wasn't listening to the speakers, was actually looking at this pretty carefully. So some of the takeaways: small businesses provide the majority of jobs in outstate Minnesota. So in 65 of 87 Minnesota counties, the majority of people work for small businesses. Which is a little odd, right? Because those are the counties that a lot of them have solid Republican representation. So are there representatives really supporting the needs of small businesses over large metro area corporations? Seems like a disconnect. Number two, small businesses make up a large percent of total employment. So 99.5% of all businesses in Minnesota are small businesses. And we provide 47.8% of all the jobs. So we represent pretty much almost all of the number of companies and half of the jobs in the state. Small business owners are just like you and me. The median income for individuals self-employed at their own incorporated businesses was $50,000. So I can tell you from personal experience, starting a small business is not a way to get rich quick. And for individuals self-employed at their own unincorporated firms, this figure was $26,000. Fact 4, small businesses do not benefit from corporate tax breaks. We hear all the time people talk about, oh, the corporate tax in Minnesota is inhibiting business growth. It's chasing businesses away. Less than 6% of all businesses in the United States actually pay any corporate tax at all. So, do I care about corporate tax rate when I'm paying $25,000 a year for health insurance? No. And the majority of new jobs are created by small businesses. So small businesses created 34,000 net jobs in 2015, and most of those jobs were created at firms with less than 20 employees. So it's a pretty clear picture. Small businesses provide half the jobs in the state, and we're the largest source of new jobs, not large corporations. But our voice is not really represented at the state capitol. So I guarantee you can go to any legislative meeting at the Capitol, any committee meeting hearing, and there will be a representative from the Chamber of Commerce there who says, you can't do this to businesses, this will kill small businesses, they can't afford this, they can't pay more taxes. The Chamber of Commerce does not represent small businesses. I'm mostly a B2B firm. I work with hundreds of small businesses, particularly over my career. It's been thousands. I've never met any small business as a member of the Chamber of Commerce. The Chamber of Commerce is funded by large corporations, particularly insurance companies, drug companies, companies that can self-insure their employees, companies like Target and 3M, who can hire a whole team of benefit managers to get the lowest cost, the best benefit for their executives, and keep chipping away at the benefits for their average sort of entry-level workers. In a way, the current system and the Chamber of Commerce's lobbying efforts really put small businesses at a competitive disadvantage. So I'm a graphic design firm. I'm in downtown Minneapolis. People come in, they go, oh, this is a cool shop. There's a lot of creativity, there's personal autonomy. I have flexibility. This would be a cool place to work. Then they look at the benefits and they get an interview at Target, a quarter mile away. Well, maybe they don't have the flexibility, maybe it's not as cool of a place to work, but they get paid family leave, they get medical benefits from day one, and at the same time, those companies are paying a much, much lower rate than what I'm paying on a small group of 5. So my high premiums are, in a sense, subsidizing large corporations who can provide better benefits and put me at a competitive disadvantage when I go to hire staff. I had a woman that I hired a year ago who loved the job. She had some chronic health issues. My policy is, you know, I'm in a pretty technical field. It takes a while to train somebody to get them up to speed. I pay 50% of people's premium after 6 months, and after a year, I pay 100%. She came in, she was there for 3 months, asked to meet with me, said she'd accepted another job offer. She said, Kevin, I love the job here, I love the work. It's not about the pay. It's that they offered me health insurance from day one. And I have some chronic health issues that I need to have taken care of. I had another employee who had been at another job for a year. She came in, she was a great candidate for the position. She said, you know, it's not about the money, but I've been at this other job for a year, and I just turned 26, so I'm going off my parents' insurance. I have to have health insurance. I'm gonna invest in at that company. I can't take this position unless I have healthcare benefits. So it's not a theoretical thing for me. It's a real bottom line issue every single day. So what have we done through these organizations, Main Street Alliance and Metro IBA? We had this beginning of the year when the legislature first started up again, we had a small business day at the Capitol. So Metro IBA and Main Street Alliance, there's a lot of crossover, particularly in leadership, and we certainly have pretty much the same goals. So we do a lot of events that are co-sponsored together. So we had a small business day at the Capitol, invited other groups. We've been partnering over the last year with the Land Stewardship Project, and they are really representing the interests of farmers because this issue of healthcare is huge for farmers. They're small business owners. They're paying through the nose for individual plans, and a lot of them, even though they may have very conservative political views, just simply can't afford the bill anymore for health insurance. So we're seeing a lot of support from farmers through the work of Land Stewardship Project. We actually did a number of candidate forums. We had a couple in for the gubernatorial election. We had a number in the metro area. We had one in Duluth. We had one in St. Cloud, and got pretty good participation from the candidates or their running mates. I think that's one of the strengths of being a small business organization. If a candidate is running for office and you say, hey, we have 10 or 20 small business owners that want to meet with you and talk about healthcare, it's pretty tough for them to turn that down, right? So a lot of it's been building coalitions with other groups, and that's partly why I'm here today. We've very impressed with the work that HCAMN is doing. Metro IBA is putting on a healthcare forum on Monday at Sunrise Bank. There's cards out front. You guys are all welcome to show up. Mark will be one of the presenters to talk about what HCAMN is doing. So we hope to have a whole range of people working on the issue, as well as maybe some intermediate steps and solutions for small businesses in the interim. So there's obviously no silver bullet on that. And I think we're gearing up to really go after this issue at the state legislature. So I testified at a couple of hearings last year, went to the Capitol 3 or 4 times to speak with specific legislators and anybody that would meet with us in general. bring the fact sheets, bring stories of our members and their experiences with healthcare, and really try to educate some of the legislators. We had one legislator at a hearing, I won't mention the party, but you can probably who asked one of our members testifying, what kind of healthcare plan can you get for $80 a month? Which would be what, Band-Aids and aspirin? I'm not sure. I've actually started asking the legislators how much their health insurance costs. You'd be surprised, most of them haven't a clue.
Really? Yeah.
And when they hear that my family pays $25,000 a year, it's sort of shocking, which it should be. We have also, over the last year, we worked a lot on, I mean, it kind of became obvious that there wasn't going to be any movement on any dramatic healthcare legislation that was going to even get much of a hearing last session. But we really thought we had a chance with paid family and medical leave. So to us, I think that's a related issue. You know, obviously, we want to retain our employees. The cost of training a new employee is generally $3,000 to $5,000. So if you lose somebody because they have to take time off to care for a sick parent or a pregnancy or birth of a child or death of a parent or any other reason, it's actually much more expensive in the long run to, you know, have that person leave and try to replace them. So if we can keep and retain our staff, it's better for us, it's better for the employees. But it puts small businesses in a bind. If I have somebody who wants 4 weeks off, 6 weeks off for the birth of a child, I would like to pay them, but I also have to hire a replacement. Generally, it's going to cost me as much or more to hire a replacement than to, you know, pay that person's normal wages. And then on top of that, I'm supposed to pay a person who's not working there. It's just pretty tough to figure out how to make that work. So the paid family and medical leave plan that was proposed would work very much like unemployment insurance. So every business in the state pays unemployment insurance. It's a tax on your payroll, right? Most business owners don't even think about it because it's not a huge amount of money. It's always been there. It's always an obligation that businesses have. These days, you know, most people aren't using it because if you lose one job, you can get another one in a week. So most businesses haven't paid out a lot in unemployment claims. And the paid family and medical leave plan would be I should have written the numbers down, but I think it's a combined 0.06 tax. So the employer pays 0.03% and the employee pays 0.03%. So one of our members said based on his one employee who makes about $40,000 a year, it's the equivalent of a, you know, $6 espresso once a week for that employee. And that would provide 6 weeks of paid time off for medical purposes and an additional 6 weeks paid time off for family reasons. So an employee could get up to 12 weeks a year paid time off. And it would be a huge boon to small businesses. We could allow people to take time off, hire a replacement, and not worry that they wouldn't be able to come back when they want to come back to work. And what a great thing for families in the state, right? For, anybody, mom or dad, to be able to take time off with their newborn child, with their aging parents. So we were pretty excited. The governor actually called, the governor's office called MSA and invited, there were about 30 of us, invited us to come. We had a roundtable meeting in the governor's meeting room at the Capitol with the governor and lieutenant governor. We then went out underneath the Capitol, had a press conference with union members, with members from Isaiah, with a lot of groups that have been working on this issue for a long time. All the media was there, and that was as far as it went. The Republicans on the Jobs Committee, which just had to clear, boycotted the hearing. So it didn't even get a hearing of the full committee, and died in conference committee. We're not really even sure why, other than the Chamber of Commerce put out a lot of false information that this is a $1 billion program and that was gonna raise all our taxes, and you know the story. So we're still hopeful on that, and certainly in addition to looking at some of the things we can do on a small scale, we also want to very much focus on 2020 and begin the work of networking with small business owners around the state, connecting with them, and educating small business owners about both the policies and the people that support these policies and the people that don't support these policies. So we're excited for that work. We are also really developing, at Main Street Alliance, we are developing a strategic plan to target specific congressional districts, legislative districts in the state, identify those districts, find small business owners that align with our values, and help them find ways to connect with their legislator to put pressure on to move some of these things forward, or at least even get a hearing. So obviously if you want to meet with a legislator, you've got a much better chance if you're one of their constituents. But it's also pretty hard for a legislator to get a request for a meeting from a small business owner in their district and refuse to meet with them. So we sort of feel like we have a little in that every legislator says they support small business. Let's see that in action, and let's try to get our concerns out to them on a one-on-one basis. So we have, Main Street Alliance has actually, our organizer had a baby end of May, so she was on paid maternity leave through Main Street Alliance, which is great. She just got back last week, but our focus for the fall is really membership, recruitment, and in particular in greater Minnesota and in sort of the outer ring suburban districts. So you guys can certainly help with that as people from around the state. I was hoping to have a bunch of member recruitment packets to bring with me. We haven't quite gotten through all the approvals yet, but in the next 2 weeks we should have those ready. So if any of you know small business owners who we think would align with the work that we're all doing here, I've got business cards out there. You can contact me directly, and I would be happy to get you some member info packets that talk about what we're doing and give them opportunities to connect with us. And I think we're doing a lot of work in broadening out our reach, both Main Street Alliance and Metro IBA. In fact, with Metro IBA on our presentation, our forum on Monday, this is kind of a new thing. It's one of the first times that Metro IBA has really tried to do outreach and connect with other advocacy groups around this issue. So the Nurses Association, HCAMN, there's a number of groups and members have been coming up with more, and so we've sent out a lot of invitations to different groups to connect and sort of broaden our reach. I think, I know a lot of you have been fighting on this issue for a long time. And what are we fighting? It seems clear. Big pharma, big insurance, big healthcare providers. Small business owners represent half the jobs, 92% of all businesses. And we're supposed to be responsible for paying for the healthcare system that we have. And yes, getting small business owners to coordinate on anything is kind of like herding cats. But at the same time, we wouldn't be small business owners if we weren't up to taking on challenges and finding solutions to problems. So I want to just say how excited I am to be here today and to network with all of you, and I think that if we can get this information out there and coordinate with our members and your members and get get small businesses to call, email, meet with their legislators, I think we can effectively fight the Chamber of Commerce and the misinformation that they spread, and some of the lobbyists that are preventing this change from happening. I think we can be a powerful ally in this work, and I look forward to it. So, questions?
Well, first of all, I want to thank you for your presentation. It was really enlightening to give the small business perspective, and thank you for working with us on this issue too. So basically, I have some questions about your business.
Mm-hmm.
Since the ACA was started, what would you say your increase in premiums have been overall these years to pay for healthcare premiums for your employees? Second, what % of your gross revenues go to paying for healthcare for your employees? And then the third one is, are you at the optimal number of employees, or are you prevented from hiring the employees you need because of healthcare costs that you incur in your business?
Yeah. So, you know, like I said, when the ACA started, our premiums went down 50%. You know, certainly some of the issue is my wife and I are both in our late 50s. So, well, she's 60 now, but, so, you know, obviously as you get older, the costs go up, and it's sort of a perverse disincentive. So if I'm hiring somebody, you know, honestly, I try not to think about it, but it's hard not to. If I hire a 28-year-old versus a 40-year-old, my costs are gonna be way less if I hire that 28-year-old versus that 40-year-old. And so that's sort of, you know, and hiring a person who's maybe in their second career or something, who's in their 50s, boy, it's almost prohibitive. So, you know, to get back to where my rates have been, so that 50% drop after the ACA, like I said, that lasted 1 year. The next year, most of that had come back. Within 2 years, we were paying more than before the ACA. I would say we average, I don't think if we get a renewal notice and it's only a 10% increase, we're jumping up and down. I mean, it can go, it generally is around 15 to 20% a year. So, you know, and in terms of our revenue, you know, it's probably only, I should say only, it's probably rough, it's over 5%. In terms of payroll though, it's a much higher percentage. I mean, it would be closer to 15%. And what was the last question?
Are you prevented from hiring the optimal number of employees that you?
Oh,
for your business?
yeah, absolutely. So I actually have a open position now listed that's sort of an expansion position. So I'm hoping our sales continue to go up. I should have hired somebody 2 months ago. I sort of put it off. Summer can be kind of slow. But I'm listing a position as a part-time when I really need a full-time person, honestly. And a big part of that is, you know, the benefit package. Again, I'm committed to paying a living wage for my employees and providing them with benefits. But I also can't overextend myself, and committing to an employee is a big commitment. You can't just say, oh, I don't want you to show up this week and I'm not paying your healthcare benefits because we're slow. So I have to make sure that, you know, which means I work extra hours, I take on more responsibilities. I can't focus on the marketing, the sales, the stuff that I would need to really expand my business more, because I'm trying to cut the margins as tight as I can before I make that leap and add that other person. So I'm advertising for a part-time position. I'm hoping within a couple months I can bump that to full-time, but it very much affects my decision making.
This may be naive, but what's the definition of a small business? Is there a maximum number of employees, and are non-profit organizations included?
Generally, I think nonprofits are not included as small business. I'm not sure why exactly, but I mean, partly because, you know, they don't necessarily have to, you know, nonprofits can get revenue through grants and other sources, so they're not, you know, they don't have to make a profit to stay in existence, basically. And as far as the definition of a small business, the SBA, the Small Business Administration of the federal government, defines it as fewer than 500 employees. I think most of us would probably not consider a company with 450 employees a small business. So again, I think that's sort of, it sort of depends on, you know, what you're referencing and who you're talking to. Yeah.
When you negotiate with a health insurer for a plan for your employees, how do they define affordability of care? Do they have a measure like we do in housing for affordable housing? Mortgage shouldn't be more than a third of your income. Do they have any kind of standard that healthcare shouldn't be more than 10% of take-home pay, or 5%, or 25%?
Well, first thing is I don't negotiate. There's no negotiating. So you hire a broker, and I've looked at different brokers. I mean, they're all selling the same thing. And a broker says, here's what Blue Cross has, here's what Medica has, here's what Health Partners has, and you take it or leave it.
Is there any way we could give feedback to the legislature about what truly is affordable based on a wage that you pay your employee? If they're gonna pay housing and childcare and buy the groceries and fix their car, how much is left over to actually pay for healthcare? Because we know that these big corporations, the Aetnas, the Centenes, the Cignas, the UHGs, their CEOs are making $26 million a year. To them, a $12,000 a day hospital stay, that's lunch. That's $5 to you and me to go out for
Right.
lunch as a portion of their salary. And I really think that people that are saying affordability of care are not talking about basic wages and what's really worth it.
Yeah, no, and I mean, I think it ties into the whole discussion of, you know, the 15 minimum too, because 15 minimum with no benefits, that's no problem for me. $15 plus healthcare plus paid time off, that starts to add up. Generally, you know, if you're paying someone's healthcare and giving them a reasonable amount of paid time off, you're paying a 25% premium on what their actual salary is. So, you know, if you're paying them $20 an hour, it's costing you $25 an hour, not including the employer portion of payroll tax. So then you're more of like, you know, then to pay somebody $20 an hour costs a company $30 an hour. So that whole discussion of, you know, what's a living wage, to me, we have to take the healthcare piece out of it, because $15 an hour, if you don't have healthcare, you're still gonna go bankrupt if you get run over by a bus. I mean, it's not affordable. Yes, sir.
Question I have is about, in smaller communities that have chamber of commerce, do you have any input on how to try to help change that philosophy that sort of permeates chamber of commerce?
Yeah, and you know, we've run into this before, and like you said, in small towns, the chamber is sort of a different function in that, you know, it provides networking opportunities for small businesses, and you know, there's still very much a sense of, you know, I don't want to go to a group of my fellow small businesses and talk about my politics, because somebody might disagree with me and then they're not going to shop at my store, right? So there's this huge disconnect between, you know, in smaller communities, the chamber sticks to business and not politics. The problem is that if you go to the Capitol and you sit in those hearings and you listen to what the chamber is saying, they're not advocating for small businesses. So there's this, you know, and they have a whole fleet of paid full-time lobbyists that know every legislator, that are at their office giving them their propaganda all of the time. And you know, I'm not sure how I mean, I think it's an education piece. But I also have to say, I think that whole notion that you can't mix politics and business is starting to shift. I've seen it dramatically, and sure, we live, you know, I'm in Northeast Minneapolis, like, you know, I can be as radical as I want, and it only improves my business. But I think we're seeing more emphasis on socially responsible business, values-based business, and you know, businesses not shying away from that. And is it a bad thing that I want my employees to have a livable wage and be able to go to the doctor when they need to, and be able to take time off when they have a baby and not lose their job? I mean, so I don't know what the answer is, but I feel like that dynamic is starting to shift a little bit. You know, and I lived in Bemidji for 5 years and went to school there, so I kind of know, you know, and I've still got friends there that have businesses, and you know, they're probably more hesitant, but I see that starting to shift there too. And Duluth is a great example of, you have a lot of young people moving there, a lot of tech companies, and that's shifting the values. And people want to talk about these issues, and there's a lot of new, younger business owners. The owner of the distillery up there, his son was born with just some really horrible heart condition, and they had huge medical costs, and they spent months fighting the insurance companies, and he's a huge advocate for reform. So, you know, all you have to do is have one experience like that, and you become one of us, right? So.
You touched on this, Kevin, and one of the most frequent areas of pushback we get when we're trying to talk to members of the public and build support is that there's a lot of hand-wringing about all the jobs that would be lost if we gave up, we got rid of the commercial insurance and the cost that goes with our multi-payer system. Is it correct to say, from your perspective, that small business and entrepreneurial activity would increase if we lifted the burden of the cost of healthcare from our small businesses, and that we'd be easily able to replace those lost jobs?
Yeah, I mean, I don't know. I'm certainly not an economist. I don't know if that would, you know, absorb all of those jobs, but I can tell you that, you know, having this piece of the issue solved would free up a huge amount of capital and energy. And I mean, I have two colleagues on that are on the board of Main Street Alliance. Both of them, one has a landscaping company, one has a restaurant in St. Paul, bakery in St. Paul. Both of them have wives who would love to work for the business and help grow the business, but they can't because they need health insurance for their family. They both have younger children. So one of them, the wife works for the school, one of the school systems, so that she can get, you know, spousal and family coverage, and another works for a nonprofit. So you have these families split who can't focus all their energy on the family business because one spouse has to work for a company or nonprofit that will provide health care for the family. And I think you would see all kinds of resources, and really if you know, again, if you look at the statistics, the growth in jobs is primarily coming from small businesses, not from insurance companies, not from drug companies, not from Target, 3M, all of those companies. So, you know, if you want to unleash this sort of economic engine, you can solve that problem by freeing up all of this capital that business owners are paying. And, you know, a lot of business owners only have 1 or 2 employees. They don't provide health insurance. They're paying on the individual market. So, you know, all those people paying on the individual market are paying huge amounts that are basically subsidizing the lowball pricing that they're giving out to these 1,000-member groups at big corporations, right?
That's right.
One of the things, you know, again, both MSA and Metro IBA support single payer plans. At the same time, we're like, if we don't see that happening, we gotta try to come up with something in the near term because it's just killing us. We've been doing some research on association plans. So why can't, as an organization, Metro IBA say, all right, we're gonna pool all our members and their employees as a group so we can get a large group rate instead of paying for a 5-person group rate. Well, we've talked to a number of brokers, and you know, Wisconsin, actually, the federal government did a rule change to allow this to happen. So thank you, President Trump, for once. Wisconsin has just made some state changes to allow that to happen. Minnesota would require some regulatory changes to allow that to happen, but then you'd have to get the insurance companies to be willing to write the plans. And a number of our members are brokers and insurance agents, and they've gone to the insurance companies and asked them about it, and frankly, they're not really interested. They don't want to see all these people who are paying individual rates get lumped together into a bigger group, because there goes their profit margin. So, but I do think, you know, I do think it's not unreasonable. That would be a great study to do on comparing the loss of those corporate jobs where you sit in a windowless cubicle filling out forms all day versus working in a small business where you can pursue your dreams and loves and interests and making a difference. And what's that equation, right? So.
A comment and a question. The comment is, when Canada went to Medicare, their employment rate actually increased 2%.
Yeah.
And the question is, how can HCAM help you? Metro IBA and Main Street Alliance. How can we help you?
Well, I think that's a great question, and you know, I would say one of the great ways you could help us, you know, you guys are all very involved in your community. So when you come across a small business owner that says, you know, yeah, it's driving me crazy, I don't know what to do about it, you can say, hey, I know what you can do about it. Let me get you some information on Main Street Alliance or Metro IBA. And again, I would be happy to provide materials as soon as they're done in a couple weeks, that you can give to people, and over the fall we're going to be developing a lot of these materials in different forms, from a little handout to more of a, you know, welcome packet kind of thing. So I'll make sure to get those to Ann, and so that they can get to chapter meetings. And then you know, Main Street Alliance has a full-time organizer, and we're working on getting funding for a part-time organizer that would work strictly in Greater Minnesota. So then we, you know, if you give us leads, we can follow up on that and make those connections. Yes.
Do you have any sense of how much your cost, personal, of $25,000 per year for your family, or your employees' costs would actually go down under a universal health care plan?
Well, I think not specifically. I mean, I guess I wouldn't know how to do that calculation, but it kind of, I mean, I guess as a business owner, the way I look at it is, you know, I've heard, I mean, we just heard tonight drug companies spend, you know, what, 30% of their revenue on marketing. You know, I know the private insurance industry has about a 30% margin on administration, marketing, all that sort of overhead stuff, compared to Medicare, which is 7%. So if you cut 23% of admin costs out of a system, the cost to the individual has to go down pretty dramatically. I also think, you know, by spreading, you know, by giving care to everyone and spreading the cost out, you know, among everyone sort of progressively in terms of progressive taxation, it just inherently has to be a fair system. I don't understand why I have to pay more for my employees' health care than Target does. Why is that? You know, what are they doing to provide more value into the system than I am? right? We're both providing jobs, we're both doing the same thing. Why do I have to pay twice as much as they do for the same product?
Quick comment on that, that's the comment I wanted to make. I actually had conversations with, interestingly, the two companies you're mentioning, 3M and Target, their human resources person several years ago, and I said, you know, why don't you want to get this monkey off your back? And they said, in the labor market, it's much to our advantage to have it the way it is now. And one of the things they said is we can vary the cost of our health insurance very easily in our products. You go to Target, buy a tube of toothpaste, you don't know that there's a nickel or a dime in there for healthcare, but it's much harder for you. Somebody comes in, you're bidding on a project, and maybe they end up ordering a little less or whatever on the price, so
Right.
it's very, very unfair. Just one other comment here, I happened to get something from the, this is the State Healthcare Access Data Assistance Center, lovingly known as SHADAC, at the University School of Public Health, but one of the figures was only 47% of employers in this country provide insurance. Believe it or not, less than half.
Going down.
Now, they would be the smaller ones, obviously, but when we think we've got an employment-based system, it's
not
kind of a
working.
bunch of baloney. I mean, we do, but it's not nearly as universal as we might think.
Yeah. All right, well, thank you very much.